Plantar fasciitis, or now known as plantar fasciopathy. So what is plantar fasciitis or plantar fasciopathy? The symptoms are localized pain, commonly towards the heel or the middle of the foot. Patients will often describe feeling pain first thing in the morning as soon as they step out of bed. And now it's no longer called a fasciitis, as there is no inflammatory response to plantar fasciitis anymore. So now it's known as a plantar fasciopathy instead. And plantar fasciopathy progresses through two phases. The first phase is the pain dominant, and the second phase is the low dominant phase. So just to recap on the anatomy of the plantar fascia, it attaches from the calcaneal tuberosity, so towards the calcaneus, to the proximal phalanges of the toes on the underneath the plantar side of the foot. And it's often thought as an aponeurosis now rather than fascia. The pain dominant phase. This is where your patients will experience that pain on the initial loading and first thing in the morning. They'll often find the symptoms are present after long periods of walking or prolonged standing. And this pain dominant phase can last anything from 2 to 8 weeks. And the second phase is a low dominant phase, and this is when that pain starts to decrease. So the initial loading, as soon as they get out of bed in the morning, that starts to decrease, and they can also tolerate more standing and walking for longer periods of time. Some treatment considerations when working with clients with plantar fasciopathy. The first thing to think about is their current activity levels. How much activity are they doing day to day? Plantar fasciopathy is really common in runners, so it may be worth looking at decreasing their loading of running until that pain subsides and you begin back into that loading phase. Another thing to think about is footwear, the type of footwear that they're wearing day to day, and then also in any activity that they're doing, as this could have effect on the plantar fascia itself and loading through that tissue. Plantar fasciopathy is also commonly found in patients that are overweight. And this is something to consider when you're working with those patients if they are overweight, as lifestyle can have a big impact in terms of their weight, their activity levels, and obviously their nutrition as well. From a clinical perspective, look at the client's ankle range of motion and also hip strength and range of motion as well. As the ankle range of motion, so what the gastrocnemius and the soleus are doing, can have a direct effect on the plantar fascia, and alongside the hip strength and range of motion as well, as if they are running and how they load into the ground can have an impact on the plantar fascia. Kinesiology taping for plantar fasciopathy is best used in the pain dominant phase when the symptoms are most acute. Here is the two-step approach to kinesiology taping for plantar fasciopathy. The first thing we want to do is inhibition taping of the plantar fascia with a fan cut taping. Now the fan cut taping just covers more of an area of the plantar fascia. The second type of taping we will do is taping for desensitization on that particular localized area of pain. Now that might be slightly closer towards the calcaneus or slightly further to the midpoint of the plantar fascia. Other options to consider may be some lymphatic drainage if there is inflammation present. You can also do a mechanical offload of the plantar fascia towards the calcaneal tuberosity, so that heavy tension on the tape for that mechanical offload towards the calcaneus, and that can often work really well to offload that tendon day to day. And you may want to also consider inhibition taping for the gastrocnemius or soleus, depending on what you found in your assessment. We begin with the client in prone position, lower leg supported so we can access the whole of the foot. I'm going to cut a fan taping of kinesiology taping for the length of the foot. Break off the anchor, so the larger part of the fan, and that's going to be placed on top of the calcaneus, just covering the posterior calcaneus. From here, individually take off the backing from each fan, and then with light tension on the tape, taking the tape along the line of the plantar fascia, spreading over the whole of the plantar fascia. rub to stick the tape down. And we follow taping for desensitisation, finding the area of pain, stretch on the tissue, light tension on the tape, and then a relaxed foot to stick the anchors and rub the tape to finish.